Hey, what's up, everyone? My name is Jaron Kitchens, and welcome to the Respire Movement channel. So, today I'm going to be talking about a part of my practice that informs a lot of my exercise selection and the route that I take with my clients, and that's going to be posture. So, we'll go over what posture is, what it says about movement, and also demystify maybe some concepts that are around posture. And before we move on, please hit that subscribe button if you haven't already, and let's get to the video. So, what exactly is posture? So, although posture can be viewed statically, meaning not in motion, posture is really a representation of how the human body expresses dynamic movement and is influenced by environmental and neurological inputs. Your posture is really just a reflection of its environment and how it is contending with external and internal forces. So I know that was a lot, but in essence, your posture is essentially a snapshot of what movement you have access to, what type of mobility you have, and it's influenced by things that we contend with in our everyday life. So, aside from physical trauma or injury, there are several different things that impact and influence our posture, from genetics, organ asymmetry, how the foot interacts with the ground, our respiration system and how well we breathe, lifestyle demands, vision, tongue mobility, occlusion of the teeth, auditory stimulus, and much more. This is why posture is really a neurological reaction. So, when we consider posture types, we have to understand this from two ends of a spectrum. Also, what I'm about to describe is a way oversimplification of these concepts, but I think it will help you to start to understand what these main genetic biases do. On one end of the spectrum, we have what you can consider a wide archetype, or someone who presents with a wide infrasternal angle or wide infrapubic angle. And these individuals tend to have a lot of backside or posterior compression. These are the individuals who will tend to have much broader shoulders and open chest. They will appear to look like they're arching through their low back a little bit more. And the postural compensations that they will tend to express are things like lower cross pattern. On the other end of the spectrum, we have more narrow archetypes or narrow infrasternal angle and narrow infrapubic angle. In general, these individuals will have more anterior or front side compression and more expanded back or posterior expansion. And they will typically have more of a posterior pelvis, and they will represent in their compensations more as flat backs. They will also tend to have more of a forward head posture. And essentially, where these two postures function differently is within the respiratory and the pelvic diaphragms. And they work differently to exchange pressure throughout the thorax and the pelvis. This pressure is compromised by gas exchange, so inhalation and exhalation, and organ and fluid dynamics. Wide archetypes tend to do really well with long duration of force on the ground, where narrows tend to be a lot more explosive type athletes. This is also the contributor to why one individual might be really good at running and another individual might be really good at weightlifting. All in all, the big differences between these two structures is how they are able to produce and manage force. And this is why when compensations do begin to happen, we want to start with restoring movement at the rib cage and the pelvis. And you do this by working on diaphragmatic breathing and getting the respiratory and pelvic diaphragms to start to interact with one another. So I think the most important misconception is that there is this ideal posture. And ideal posture is typically represented with shoulder blades back and down, really tall, long spine. And the reality is that's just unrealistic given many different factors. So we have to understand that postural symmetry doesn't exist, nor would it be to our benefit if it did. Human beings are naturally asymmetrical. Most of our organ weight is displaced to our right side. We also have a lot of muscular asymmetries. And our left and right respiratory diaphragms are actually different in size, and therefore they actually have different functions. And these asymmetries exist everywhere within the human body. Now, given all of these asymmetries, human beings are naturally going to be more oriented to the right side, and this isn't a flawed design. And when we consider that human beings are either going to have more of a wide archetype versus a narrow archetype, say that forcing one particular ideal posture just doesn't make sense. So, with all that said, this doesn't mean that working on posture isn't irrelevant or isn't helpful. So, before we move on, a key concept to understand is that muscles do not influence posture. The position of a joint is what actually influences what the muscle does. For example, piriformis, which is commonly known as one of our hip external rotators, actually becomes a femoral internal rotator around 90 degrees of hip flexion. And that's because once the attachment sites change position, the fiber orientation also changes. So when the fiber orientation changes position, it has more leverage to create a new or different rotation. Now, with that context in mind, it's important to note that there are normal or standard measurements for spinal curvature and range of motion. But what is most important is not that the spine or the joints stay in these averages, but more so has the ability to express them in motion. Therefore, when someone is having an inability to perform a specific task, whether that's bending over to pick up a barbell or grab a can of soup out of a cabinet, or begins to feel chronic pain, then it can become relevant to start to work with posture and understand where you are falling out of these standard deviations. In essence, this then becomes mobility training. And when you start to be able to restore mobility at the joint, posture then is able to change shape. All right, ready to get confused? And just because someone has a particular posture doesn't mean that they're going to be in pain. There is a greater association with being in pain and having a loss of motion than anything to do with posture. And just because someone has lost movement doesn't necessarily mean that they're going to be in pain either, while simultaneously understanding that posture is a representation of how much movement freedom you have. I know, confusing, right? So, is doing posture work important? Yes and no. It depends. Working on posture can be important, but understand that there is not an ideal posture. And when you do start to feel pain or have the inability to express a certain range of motion, then the ideal posture is the ones that you cannot express. Remember, posture is fluid, it's dynamic. As we walk, we should be accessing many different postures constantly. So I hope you guys enjoyed this video. Please give me a like and a share. I would so appreciate it. And I'm going to go ahead and leave you guys my free breath and posture reset program down in the description below. If you guys have questions, please reach out and I'll see you guys on the next one.